So, as I indicated, South Africa, of course, will be moving to alert level 1 of the lockdown at midnight on Sunday. And the WHO here on the continent has commended South Africa for its effort in the fight against COVID-19 and flattening that curve. Let's join Dr. Ambrose Talisuna, who's the Program Manager for Emergency Preparedness at the WHO Regional Office for Africa. Very good evening to you, Doctor. Thanks indeed for joining us tonight. So you've said that, a stronger public health system in South Africa had basically helped to limit the exponential spread of the COVID-19 pandemic. But I'm really interested to know, what has COVID-19 taught us here on the continent, and what can be done to strengthen our health systems across the board?
Thank you very much. What COVID-19 has showed us is that we need a strong health system. We need what is called health system resilience. Health system resilience is the ability to maintain the delivery of essential services, even in the absence of shock events. So when you have a shock event like COVID-19, you need to have a strong health system. And if you look at here in South Africa, in the early phases when lockdowns were implemented, South Africa wrapped up case management capacity. South Africa wrapped up community screening and testing and was able to identify cases very quickly. South Africa also has a very good information system. And also, I think the hospital system is very good here for both the public and private. That's the kind of system that we need. The system needs to be organized. What can be done? I think we need to make sure that we build and sustain functional health system. And functional health system means that we need a health workforce. You need health infrastructure. You need health products. But for us to have health system resilience, we need to build what are called the international health regulations core capacities. These international health regulation core capacities came in force into 2005, but most African countries, actually globally, only less than 30% of the countries have all those capacities. So we need the IHR core capacities to be built in every country because it is the only way we can respond to events like COVID-19.
And Doctor, I want to talk about where we are at the moment, with the relaxation of lockdown levels. Borders will reopen once again. We still need to be very cautious. I mean, what should countries on the continent be doing to ensure that we don't have a resurgence of high infection numbers like we're seeing in some parts of Europe? That's of great concern at the moment.
I think that's a very valid question. What we are seeing in Europe and elsewhere in the United States is that we have had a resurgence. But I think what South Africa is doing, and that's why we really commend South Africa. South Africa now, with the declining number of cases, has embarked on what is called developing of a resurgency plan. The resurgency plan means that we need local data in the world, data from the municipalities, so that we can identify hotspots. Once we identify those hotspots, then we send in, as it were, like SWAT teams. So we are supporting the country to be able to look at what is going to be the alert, what do we call an alert threshold. So when the numbers begin to reverse, because like now they're going down, they might plateau. When they begin to reverse, there should be a mechanism that we put in place, the coordination mechanism which is already existing for both national and subnational level in the provinces. We need to make sure that those war rooms are reactivated, the nerve centers are reactivated. We need to make sure that we are having good data. We need to make sure that some of the hospitals that are being decommissioned can be put back in case we had cases. So it's critical for South Africa to have a resurgency plan. And it's critical for every country in Africa to have a resurgency plan, because that is the only way we shall mitigate new cases. But the public has to observe the measures that His Excellency the President said. We have to use masks when we're in public places. We have to continue physical and social distancing. We have hand washing is a critical piece of our work. But also we need infection prevention and control, especially for our health workers. Yeah. Health workers are not supposed to die when they are delivering a service. We are supposed to be saving lives. We need to make sure that our health workers have all the equipment. They have all the personal equipment that they need.
Doctor, I must ask, we talk about resurgency plans that each country should have. What would the role then of the WHO Africa be in supporting South Africa and other countries as, we ease these restrictions and open up the economies?
Let me just give you a background. If you look at what WHO has done, when we first got the cases, in the early phases of this outbreak in early February, there were only 2 labs that could diagnose COVID on the continent. Here in South Africa and in Senegal, Pasteur Institute in Senegal. At the moment, every country is in a position to be able to diagnose COVID-19. But that diagnosis needs to be decentralized. Because if the diagnostic labs are only in Pretoria or in Johannesburg, They have to be where the cases are. So we need to make sure that all African countries have decentralized laboratory services. They need to have a good surveillance system everywhere. We need to be able to detect every case. So we have routine surveillance systems, which we call indicator-based, but they should be able to detect clusters of deaths, clusters of COVID-like illness. Anything that looks like COVID should be able for us now, should send us to be active. Yeah. We need trained people, human resources who can detect, who can treat people, who can isolate cases when we identify them.
Dr. Ambrose Talisuna, I wish we had more time. I wanted to ask you about other pressing issues, of course, that we will face as a continent as we get out of this particular storm. Thank you very much indeed for your time here on The Full View. Dr. Ambrose Talisuna, Program Manager for Emergency Preparedness at the WHO Regional Office for Africa, commending South Africa for its effort in its fight against COVID-19.